Senator Dr. Tim Gopeesingh.
Mr. Vice President, may I, at the commencement of my contribution today, acknowledge with graciousness the privilege afforded to me by our internationally distinguished and brilliant opposition leader, former Prime Minister, and Prime Minister to be once again in 2025, Mrs. Kamala Persad-Bissessar, to contribute on this 2024-25 finance bill in the Senate today, a place, Mr. Deputy Speaker, which I entered 23 years ago in 2001 until 2007, and then elected to the other place until 2020. Our political leader, in her powerful, brilliant, and formidable budget response to the Minister of Finance, which was deemed a decade of debt, $120 billion borrowed by this government, deficits, almost 10 years of consecutive deficits in the budgetary allocations, destabilization of the economy, deaths, killing fields in our hospitals, COVID deaths, NICU deaths, and destruction of almost every aspect of life in Trinidad and Tobago. So, our political leader, in her powerful and formidable response, presented a deep and incisive analysis of the Minister of Finance statements on health and education, two areas which I will speak about today, once given the time. The opposition leader presented far-reaching policies, programs, and recommendations for implementation in health and education, amongst other ministries, when she once again regains Prime Ministership in 2025. I will now address some of the issues on health related to the budget 2024-2025 finance bill, and if time permits, on education. Mr. President, we are all critically aware that both health and education are the cornerstone and fundamental pillars of any civilized and developed country, and it is a constitutional requirement for provision of equitable, efficient, high-quality health care and education in any country. It's a constitutional requirement for the citizens and for the government to provide these type of services. Mr. President, with this budgetary allocation of nearly $7 billion for health in 24-25, it is supposed to take care of expenditures for the management of the 4 regional health authorities, the Ministry of Health, 10 hospitals, which we have, 105 health centers, and 9 district health facilities, which are supposed to be open 24 hours. Mr. President, why is it in Trinidad and Tobago with all these hospitals and health centers and 10 hospitals, 9 district health facilities, 105 health centers, thousands of medical workers, doctors, interns, registrars, house officers, staff nurses, paramedical professionals? Why are we in this state in the health sector? Why are patients continuing to suffer and we have loss of preventable lives? This is unsatisfactory and cannot be allowed to continue. But we still have widespread shortage of nurses. 1,300 nurses needed to be employed, and they're not being employed. And nurses are not even given contracts. They're given 3-month contracts. They don't have any justice for in their employment, and they're played upon by the regional health authorities, boards, and chairmen with month-to-month work and so on, and the doctors as well, the young doctors. So you're damaging the psyche of these professionals, of nurses and doctors, and paraprofessionals as well, in not giving them secured contracts so that they can earn a living, they can go to the bank and borrow money to buy a car, and they could put money for a house. This is the state of affairs in the health sector, being played upon by the chairman at the regional health authorities board, and by the CEOs, and by the executive management. So, Mr. President, we have a health system which over the last 9 years has spent close to $63 billion. Out of over $500 billion, more than $500 billion has been spent by this PNM government over the last 9 years. In fact, $550 billion and counting more. $63 billion of that has been spent on health sector for these 9 years, and another 7 allocated for this year. And where are we? Where are we? Patients are dying like flies in the hospitals. The hospitals are like killing fields. And today, the population is still finding it difficult, Mr. President, for their health needs to be adequately fulfilled. And we are now with a health system which has been, over the last 9 years, particularly, unable to cope with the demands of the population for effective and safe health care and delivery. Thousands of patients are suffering at home for months and sometimes years at home, are waiting for a call for surgery, for clinic appointments, and they are waiting for proper medicine to be given to them. Mr. President, I just want to quote a little article that I saw just a few days ago on Newsday, Friday, October 18th, 2024, last week Friday. And it headlines, "Waiting Years to See Doctor at Complex." To the editor, I write to highlight a severe problem at the Eric Williams Medical Sciences Complex, Mount Hope. Presently, there are patients of the heart, kidney, and other clinics who have not seen a doctor for at least 3 years or so. What is happening at the complex is that every 6 months, the patient goes in and receives a new prescription for CDAP medication. Why are the patients not being given an appointment date and time to be seen by a doctor in the respective clinic? Is this some kind of shortcut? And goes on. I know of people who have had stent insertions, that is cardiac stent insertions, for 3 years or so, and to date cannot be seen by a doctor. Imagine you have a cardiac insertion done, and you're 3 years after you can't see a doctor. As well as people with heart and kidney problems who would have last seen a doctor 3 years ago. That's the state of our health sector. $63 billion spent, and another $7 billion to be spent. The article goes on, the person says, we must do better than this. These are people with medical conditions who would have worked and contributed to the health surcharge and other taxes and now have to be at the mercy of others in authority. And is signed by the person. Mr. President, it is on this indisputable fact that patients continue to die on trolleys and wheelchairs in emergency rooms of the hospital, waiting days to get an inpatient bed. Just last night, one of my colleagues who had been my partner in medicine and surgery for 50 years, one of my anesthetists, took his grandson to the hospital, in the pediatric hospital, and had to wait for more than 12 hours for that child to be admitted into a room, into a bed. And right next door, there was an empty pediatric ward. So where is the healthcare management? Our patients have waited for days in the emergency department. You know how many calls I get on a regular basis, being a senior member in the medical profession. Doctor, please try and help me. My family is there for almost 3 days and can't get a bed in the hospital. And there is no one to call, no one to answer any questions. And the patients die. They die on the wheelchair or the trolleys in the hospital. And this is the state of our healthcare system. They wait for days to get an inpatient bed, having to get blood tests done privately. They don't even have reagents in the hospitals to do blood tests. By the time the family goes out and get the blood test done and have the result, the patient is dead. Lack of surgical equipment. I have a few colleagues in here who are doctors, and they will know that there are surgical equipment and instruments you need for neurosurgery, for orthopedic surgery, for cardiac surgery, and then these surgical procedures need equipment and instrument, and they're not there. There's ineffective or outdated drugs within the CDAP program, many of which are unavailable. retired, begged the Minister of Health to improve the types of medicine for treating diabetes and hypertension. 5-cent drugs. How can you treat hypertension and diabetes with drugs which are not effective? You have the cheapest metformin, and the antihypertensive drugs are the cheapest. How can you treat non-communicable diseases like this, which gives rise to blindness, to heart attacks, to strokes, to kidney failure, to amputation? We have over 500 amputations per year in Trinidad and Tobago because the diabetes and hypertension for the patients are not controlled. And the Minister of Finance himself said there are over 260,000 citizens depending on the availability of these pharmaceuticals in the CEDAR program. I read this in the presentation of the Minister of Finance in his five-hour-plus budget presentation. So, Mr. President, 260,000 citizens, nearly 250,000 citizens of this country, have to depend on CDAP drugs. That is to show the poverty and what is happening in this country. 250,000 citizens have to get CDAP drugs. And when they go, they can't get it because most of the drugs under the CDAP list are not there. So why is it that this population have to be subjected to this gross mismanagement and incompetence and incapacity of the Ministry of Health and the head of this sector, the Minister of Health, to deal with this? For the last 9 years, this country has been subjected to a number of infections with the Aedes aegypti mosquito. Chikungunya, I don't know if how many of you remember that. Chikungunya, which gave rise to serious musculoskeletal disorders of the joints and muscles, long-lasting. Then you had a Zika infection of pregnant mothers, and the Minister of Health was silent then, causing microcephaly and congenital malformation in the infants, which is a congenital Zika syndrome, where scores of mothers were infected. And the Honorable Minister of Health refused, or possibly unashamedly refused, to inform the population of how many mothers were affected and now having to care for their young children who have developed major congenital abnormalities, which are considered worse than cerebral palsy. They have microcephaly, these are the poor children, and their brain is dysfunctional. Their mothers who developed Zika during the pregnancy gave birth to these babies, and the minister has done absolutely nothing about that. There are scores of mothers in this country who have to take care of babies or who were affected by the Zika virus, and nothing is being done to help these mothers, and so. A shame, Mr. President. And so these mothers now have to care for these young ones and young children for the rest of these children's lives, like a cerebral palsy child, and for the rest of their mothers' lives. And then came COVID, Mr. President, in 2020, and where we warned the government that this COVID is coming on, and we raised motions both in the Law House and in the Senate, which were not approved for discussion. Zika came in, COVID came in a few months later, and we raised it in January 2020, when it was declared an emergency. Hundreds of preventable deaths occurred, Mr. President. 4,600 died as a result of the COVID infection. And when the Ministry of Health was pressed, and the Prime Minister was pressed into doing something about it, he said, all right, I will have a Simongal report, a Simongal commission, which he gave them 1 week to have inquisition into it. They asked for more time, they got 1 month. And so, Mr. President, the Simongal commission met. 120 pages of documentation and 19 major recommendations made from the Simongal Commission of Inquiry. 120 pages in 1 month. They did the work. 5 top professionals. We congratulate them and we thank them for the work. 19 major recommendations made, and up to today, that is in February 2023. 18 months ago, Mr. President, 18 months ago, these recommendations, and not one of those recommendations has been fulfilled. What a shame and disgraceful attitude from the Minister of Health and the government as a whole. Who monitors the ministers? Does the Prime Minister monitor the ministers to see what work they were doing? I remember when we were ministers of government, our Prime Minister would ask us on a regular basis, where are you going, what are you doing? But to inflict this present Minister of Health on this population for 9 years into a 10th year is unpardonable. It is criminal in nature, Mr. President. It is morally wrong to have this present minister continuing as Minister of Health in this country. I stand in strong objection to that, and I'm a doctor for over 50 years, and I've worked in 19 hospitals around the world. I've trained at 4 universities. I've taught over 3,500 young doctors. I was a professor at the university. I helped to pioneer opening up the medical school in Trinidad, Mr. President, and this is what we have to
Point of order. 46-1. I don't need to hear a resume of Tim Gopeesingh at this time.
Okay, members, allow me to, members, Senator Naked and all other members. Okay. Senator, again, the budget debate is relatively wide, but not too wide. So if it is that you're going down that road, to just, give an understanding of your qualification, do so briefly. Don't spend too long doing it and move on.
Mr. President. So, Mr. President, here it is that we have to spend another $7 billion. So we spent $63 billion already. And we don't know where we are going and what we are going to be doing as far as the health sector is concerned. So we know that the Simongal report has been there. It has 19 recommendations. Nothing has been done about it. And you know what, Mr. President? A week after the report came out, the government put out an ad, Tuesday, February 14, 2023, request for expressions of interest, consultancy to conduct an assessment of the Ministry of Health's response to the COVID-19 pandemic. A big full-page advertisement from the Procurement and Contracts Management Specialist Health Services Support Program. Today, we have nothing. In terms of what is being done about the Simongal report and its recommendations. So, are we going to be spending part of the $7 billion that's given to health? Are we going to be looking at that? I want to recommend that we take an active interest in ensuring that we try to determine what has happened to this request for expression of interest and what has been done or what will be done with this $7 million if it is going to analyze the Simongal report recommendations and implement some of the recommendations. So, Mr. President, then we continue to have more deaths following the dengue epidemic or dengue infections. What has the Minister of Health done with the money from last year in terms of fighting the dengue virus? Where more than 20 have died so far, and it's continuing. This is what has been reported. So there's serious morbidity of hundreds of other citizens from the infection by the Aedes aegypti, which the Minister and the Ministry of Health failed miserably to address and continue to fail and deal with from a preventive aspect, but continue to blame the citizens and threatens to jail some of the citizens in the midst of his widespread incompetence and mismanagement. So this $7 billion allocated for health, Mr. President, would it be able to address and deal with some of these situations similar to those in the past? We say no, based on what has happened over the last 9 years and the serious mismanagement and incompetence by the Ministry of Health, by the Minister of Health, and by this government of Trinidad and Tobago. And so $63 billion spent on health sector, but hundreds and thousands of complaints about mismanagement in the health sector by citizens on a yearly basis. I want to state, Mr. President, that when we get into government in 2025, the citizens of Trinidad and Tobago will be rest assured that we will establish a hotline so that citizens who feel disenfranchised and feel hurt by the health situation would be able to call in and get redress on a regular basis, even though there might be 2 or 3 telephone lines that we will have to use. Mr. President, in fact, the Leader of the Opposition, in her response to this budget, gave 50 policies and programs that over 54 that as Prime Minister in 2025, she will establish in the health sector. And she enumerated those 54 policies and programs in her budget presentation. And for those listening, you could find it on YouTube on the Parliament channel of all the recommendations that the Honourable Leader of the Opposition gave on the health sector for the future in 2025 when we take office. Mr. President, the health sector has reached a stage where criminals were murdering citizens at the emergency department of hospitals. Criminals entering wards with patients and nurses scared to death, to infrastructure problems of collapsing ceilings near operating theaters, flooding in hospitals, refrigeration systems failing in the mortuaries with corpses rotting. I was just informed just 1 week ago by my colleague, one of the refrigeration units in one sector of the hospital went down again, one of the standby generators. And there was no access to patient notes and other things were disenfranchised for that 24 hours. How could you run health centers, hospitals, without proper standby generators backup, Mr. President? There had been repeated widespread electrical outages, malfunctioning standby generators, with one particular incident with patients in the intensive care unit at Eric Williams Medical Sciences Complex, ventilated patients, patients on the ventilator, having to breathe with the ventilator with an electrical outage, having to be resuscitated, so the electricity gone, the resuscitating equipment gone, stop. So what do you do? Let the 6 or 7 patients on ventilators die? The nurses and the doctors had to go in and start pressing with ambu bags, 12 presses per minute, to put air into the lungs of these patients to keep them alive. And then 5 or 6 patients had to be transferred from Mount Hope to Arima Hospital, being ventilated manually with ambu bags. The minister stayed quiet. The government is quiet. How many patients died as a result of that? The transfer? No, not a word. Silent. Keep it quiet. That is very unfortunate. You're running a health sector. You're running hospitals. One of the fundamentals is to have standby generators and checked every day. Every day, these standby generators. I remember when I was chairman of the Regional Health Authority in 1997 to 2000, I ran 2 of the 4 regional health authorities. In my second month, standby generators at Port of Spain Hospital went down. I was amazed. I had done nothing, but I made sure within 1 or 2 months that all areas of the Northwest Regional Health Authority had standby generators functioning efficiently. That's 97, 98. And here it is in 2024. We have standby generators going on. $63 billion spent, and you can't buy standby generators and having them functioning properly. So blame has to be put on the management, the regional health authorities, the boards of the RHA, whom the government appoint, the CEOs. You have a CEO at Mount Hope who's really fit to be a manager at the Miss Atwell Center in St. Anne's. That's the Queen's Hall, the old Queen's Hall. He's best to be suited for the Carib Theatre and best suited probably for NCC. But he is the CEO of a hospital, Mount Hope Medical Complex. He started as an attendant. I mean, God, it is not to cry down anybody, But somebody with no healthcare management skills and competence running a Mount Hope Medical Complex with so many district health facilities and a whole complex like Mount Hope? No, Mr. President. That can't work in today's time. It's pathetic. It is shameful, disgraceful. So the biomedical engineering team, where are they? Who determines what is happening in the hospital? Who checks? The biomedical engineering team. You have boards of directors who don't know regional health authorities, have not been on the hospital wards to see what is going on in the hospital. When we were in government, Minister Khan and a number of us used to walk the hospitals, see what is going on. We asked a CEO one day, when last you made a ward round? And he said a month ago. We fired him. Fired him. So we don't know how many have died as a result of this transfer of the patients from the standby generating system that was not functional. There was another blackout at San Fernando Hospital where patients were being operated on in the operating theater, and a blackout occurred. You can imagine as a surgeon, I'm a surgeon for 40-something years, and a blackout occurred, a nurse had to come and shine a torchlight for you. Private nursing homes don't have that. They have standby generators that kick in right away. But thank God, we don't know what happened, and there are 6 operating theaters, at least in San Fernando Hospital, functioning at that time. So we don't know what happened as a result of that. So this cannot be allowed to happen in any health system, in any delivery, in any developed country, Mr. President. And it's because the regional health authority boards, which the minister and the government appoint, are really incompetent. And I say that unashamedly. You can't put square pegs in round holes. Healthcare is something by itself. It is not running a sweetie parlor or anything. You're playing with people's lives. So you must have the best people at the top. And you can't get political appointees to run a regional health authority board or to be a CEO. They run without any management capacity and capability, and it rots from the head. And if the head is rotting, everywhere else will rot. So we have basic drugs that are lacking. So, Mr. President, are we in this 2024-25 budgetary allocation of $7 billion? Are we going to be moving to prevent any exacerbation of neonatal deaths in a neonatal intensive care unit, as we had this year with 19 babies dying in the short period, neonates dying within the short period of time? And while the Minister of Health and his team were trying to fool the population, boasting almost on a yearly basis, every time you hear the minister, decreasing maternal mortality, neonatal mortality, decreasing all the time, and while it is increasing. And he was trying to gaslight and hoodwink our population. Mr. President, when the population became angry and the newspapers flooded with articles, hoggish conduct at the neonatal intensive care unit, nurses in emotional turmoil over deaths of babies, says TTNA boss. Our political lady has said deaths of babies are blight proof of health crisis. Then the NWRH put out a little article about neonatal intensive care unit at Port of Spain General Hospital. The TTNA boss said nurses in emotional turmoil over deaths of babies.
Senator, date and time, and the actual newspaper, if you're reading from the article in your hand.
Oh, you want the, right. Saturday, April 19, 2024. This is Guardian. This here, the Saturday Express of 20th April 2024. Deaths of babies at Port of Spain General Hospital. Kamla calls for immediate opening of Children's Hospital. Slams government for malice and spite. Then you have Newsday, Saturday, April 20th, 2024. NWRHA, they're saying only 7 babies died of bacterial infection. and there were 19 babies who died. And then Sunday, April 21st, Guardian, 951 neonatal deaths in Trinidad and Tobago between 2018 and 2022. 4 years, 951 neonatal deaths. Neonatal death is the death of a baby within the first 28 days of life. A perinatal death is within the first 7 days of life. So 951 babies died in 4 years within the first 4 weeks of birth. Progress in reducing mortality rate hit hard. And there's one article, UNC supporters call for Children's Hospital to be opened in Hoover, and so on. So many articles, Mr. President, too much to read. And then on April 20th, 2024, the leader of the opposition, Saturday Express, in the face of 11 baby deaths, Kamala calls on the Prime Minister to have a conscience and show humanity, open Hoover Children's Hospital, and so on. Tobago mom wants answers. So I just decided to bring these articles along to show, Mr. President, that this country had been subjected to improper health care, the citizens, the babies, the young ones. And when the pressure was put on the government again, then they asked for an investigation to be done into what was happening at the neonatal intensive care unit. And PAHO sent a review mission to Trinidad and Tobago, and a report was published on the 21st of June 2024. Review mission, clinical events, neonatal intensive care unit at Port of Spain General Hospital, April 2024. And Mr. President, it's a very damning report on the management at the neonatal intensive care unit at Port of Spain Hospital. The Minister of Health has to take responsibility. The boards have to take the responsibility. The CEO, the management, and of course, ultimately the government. And some of these findings, prevention and control strategies, institutional policies for central line insertion and maintenance in NICU are not used consistently. Policies and procedures for prevention of surgical site wound infection in operating theater is not done. Antimicrobial stewardship program is not implemented. Inadequate ratio of nursing professionals to patient ratio is present consistently. And so I think there was an article today or yesterday where the head of the Nursing Association said that nurses are still not being employed to fill the vacancies in the neonatal intensive care unit. That's the head of the Nurses Association. And this is what continues. Policies and procedures for use of multi-dose medications on NICU need to be developed. NICU unit dose medications are not prepared in sterile conditions by pharmacy. There are no policies, no procedures for high-level disinfection for equipment such as laryngoscopes. Limited hands-free alcohol-based hand rub dispensers in NICU. Breaches in personal protective equipment protocols observed in the NICU, indicating a need for improved compliance, monitoring, and training. And there's so much more about. Yeah.
You mentioned just now that nurses are not being employed. Is it that they are not applying, or is it that the institution is not taking them on board? Because of the fallout that you had before, they may be reluctant to apply. So could you clarify for me, please?
For my understanding, Senator, they have been applying because the president of the Nurses Association wants employment of these nurses. There are over 1,300 nurses wanting jobs. And they are not being employed by the regional health authorities because the regional health authorities say they don't have money and they're not employing anybody. And when they employ them, they frustrate them. They don't give them any contracts. So they give them, and my colleague, Dr. Remy, one of the best pediatricians this country has ever seen, one of the best. I have tremendous respect for her competence. And I'm sure she will agree with me that they're treated badly. You have over 400 young doctors in this country wanting jobs, and they can't get a job. Their parents pay millions of dollars to educate them, and they can't get a job. And we have 32 centers in a hospital system, 32 different units in a hospital system, where you just take two.
Senator, you have 5 more minutes.
10 more minutes? 5? What? Well, I think, Mr. President, the country has gotten, the Ministry of Health, the Minister and the government has gotten the message from the opposition loud and clear. They have been very incompetent in dealing with the health sector. A lot is to be desired, and we expect a lot better of them. But when I'm closing that, I will make a concluding statement. I was hoping to be able to deal with some parts of education, which is another area which the government has fallen badly on. And from my just 1 or 2 minutes left, it's unfortunate again, Honorable President, that this government, within the first year of us demitting office, there was swift and precipitous reversal of all the gains that we made in the education sector between 2010 and 2015. They reversed almost everything. They stopped the laptop programs, they stopped the construction of school programs, they stopped the early childhood education program, they stopped the textbook program. We had given out over 2 million textbooks to students over the period 2012 and 2013. Every child in every class in every school got a textbook. Then we give out 97,000 laptops. And in 2020, when this thing came on, when the COVID came on, over 100,000 students in this country were left without an IT device. They were left out of the education system for 2 years, Mr. President. So you could understand why 9,000 students failed to get more than 50% in the SCA. Yeah. That is why. Yeah. And this is where the crime is coming from. This is where the crime is. 9,000 students.
Senator Naked, there's one speaker currently on the floor on your best. Senator Naked. Senator Naked. Senator Naked, I'm on my legs. 1. 2, please face the other side. Your back is to the chair. Thank you. Senator Gopeesingh, continue.
Yeah. Mr. President, they stopped the textbook education program. They stopped the school construction program. They stopped the continuous assessment component. They stopped the areas of morals and values and ethics and citizenry development and character development, which we're teaching. Music, arts, and drama in primary schools was stopped. 402 homework centers were stopped. We had up to 3 computer labs in secondary schools. All of that was destroyed. 150 IT technicians were sent away from their jobs. They reduced the amount of social workers and in the Student Support Services Division from 700 to 350, and hence the rise in the problems of the school violence in the schools. And we could talk an entire day on that, but 40 minutes is not enough for me to speak about. They reversed the early childhood education program when we were the first country in the world to have achieved early childhood education. We had the best academic performance in 2014 in SEA, CAPE, and CSEC. And we bettered it in 2015. We are now last in the world. We were on par with Finland, Singapore, Hong Kong, Korea. We were awarded medals for our work in education. We were the center of virtual educa in Latin America and Caribbean. We were the leaders in ICT in the world. Putin in Russia was trying to follow us. 3,000 schools he started around the same time we started. President Obama started the laptop program around the same time that we started. We led the Latin American Caribbean with ICT in education. So, Mr. President, as I conclude, I reiterate that the government is on a rapid, dangerous road of fostering a complete economic collapse of our economy. Never before has this country ever seen such wanton incompetence, corruption, and mismanagement of our economy. Where has the over $500 billion gone? Where have they been spent? taxpayers' dollars. Where has this gone? They have failed for almost a decade now to create new revenue streams, new industries, job creation, and stimulation of business, improve our country, and ensure the progress and prosperity of our citizens. Their only concern is about spending money, and they're not even interested in accounting for the money they spend, as the Auditor General reports notes. In this budget and in the previous 9 budgets they have delivered since 2015, they have consistently and shamelessly come to this country with failed policies, numerous broken promises, wanton misstatements, and wastage. This budget, like all their previous ones, will continue to embroil our citizens and nation in a hopeless cycle of poverty, joblessness, criminality, violence, and despair. They have no choice now but to resign, for they have failed and continue to fail the people of this country. Mr. President, let us call election and let the people decide.
Senator Ibrahim.